The following paid program does not necessarily reflect the views of this station, its staff, or iHeartMedia.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome to The Moving Body, this time live, August 1st, 2015, if you can believe that. What happened to January through July? It seemed like yesterday only that we were saying Happy New Year to each other. But here we are, August 1st, a little bit stormy outside. We got that Guillermo coming up, so make sure you got flashlights and water and medicines and food. I saw in the newspaper online today, I don't get the regular paper, but online the local newspaper, what do they call it now, the Star Advertiser, had some tips about what you should prepare for, because we got a hurricane headed our way. Although I'm not sending out an alarm. In fact, what I read is the latest prediction, which of course might change, is that it'll be downgraded and just be a good storm and pass closest to us maybe middle of the week. But pay attention to that and be prepared in any case, because we're headed into that season. Well, thank you for joining me. My name is Dr. Bernie Portner. Like the man said, I'm an MD specializing in the diagnosis and non-surgical treatment of painful conditions affecting the limbs and spine, and your host today and every Saturday at this time to take your calls and try to answer your questions on our radio show, The Moving Body. We talk about the body parts that move. We talk about the body parts that allow us to move. We talk about bodies that move and how important that is. The number here, 521-8383. Give me a call if you have any questions for me. We can talk about orthopedic type problems. We can talk about health and fitness, sports injuries, work-related injuries, car accidents, just like I have over at the office. Neighbor Island listeners have a toll-free number at 1-888-565-8383. So there you have it. Like I say, the lines are open right now. They might not be in a few minutes, so don't delay. Speaking of the office, we have two. One is new, relatively new. We moved a year ago later this month over on Bishop Street. We're no longer on Pi'ikoi Street, but Bishop Street, right downtown, plenty of good parking, beautiful facility. And we also have a clinic over in Kaneohe on Kamehameha Highway in the American Savings Building, right before you get to the big shopping center there over on the left. And we're remodeling there, so it's going to be bright and spanking new and ready to go come Monday. Dr. David Bro, who has been out of town on vacation visiting relatives on the mainland, he's coming back this weekend and will be back at the office Monday. So you can call the office to see either one of us in Kaneohe or downtown on Bishop, 596-7300. But if you have a problem, why not call now? We can chat about it. Let me take my first caller here. Nanny, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Portner. I listen to you all the time.
That's very kind of you. How can I help you today?
Well, I just wanted to help other people out there. I had terrible sciatica, so bad that I used to have to lie down in bed, put a washcloth in my mouth to keep myself from screaming and waking up the neighbors.
Wow. And how did you get rid of it?
There's this wonderful, wonderful machine you can get at Bed Bath & Beyond. It's called Back to Life.
And what does it do?
Well, you lie on your back, you put your legs over this T-shaped machine.
Yes.
And it slowly rotates your legs very, very slowly. When you're doing it, you think, oh, this can't possibly do anything for me. It cured me. Within 2 or 3 times, I had no sciatica at all.
How long ago did you do this?
This was maybe 2 years ago.
Wow.
And
how
I
long
haven't
did
had
you
any
have it?
sciatica since then.
And how long did you have it since before then, before you got rid of it? How long were you suffering?
It came on suddenly. and it seemed like I didn't have it before that.
I understand, but you did have it before you got this contraption.
Yes, I did have it.
For how many weeks did you have it is what I'm trying to ask.
Oh, okay. It's hard to remember, but I think it was about 5 or 6 days.
Right. So thank you very much for that. And if anyone's listening, Bed Bath & Beyond, I guess, has that. Thank you,
yes,
man.
You're welcome. Bye.
Bye-bye. So that's a very interesting story, isn't it? Let's talk about that. I wanted to welcome Sabello. He's here recording the show, video recording. So here I am in rare company with Howard Stern and Imus, who made famous the video recording of a radio show. So I put on a nice shirt instead of my usual T-shirt. But thanks for coming, Sabello. That's great. And he's helping me with search engine optimization, I guess. SEO is the way to call it. He has a company called 100innovations.com. So if any of you out there want to promote your website and get it to come up on the first page of a Google search, he's the man to check out, 100innovations.com. Anyway, this last call was pretty cool, actually, because it brought up several points that I like to talk about while we're waiting for the next call. And if you have a question, 521-8383. First of all, the term sciatica was brought up by Nanny, and she spoke of sciatica as if it was a diagnosis. I suffered with sciatica. So be careful there, because sciatica is a symptom, and it's okay to talk about it as I suffer with sciatica, as if you are saying I suffer with pain in the back of my thigh. But it doesn't presume to know what's causing the sciatica. I've talked about this over and over, and for my regular listeners, you're probably sick of hearing it. But she was talking about sciatica as if that was the diagnosis that she had, and it's not. She had pain in the back of the thigh, and she had it for 4 or 5 days. Then the other thing I want to point out about that call, and it was very nice of her to call and share that, because people by nature want to help each other. That's what we do. That's what we do. We help each other. So I really appreciate the call, but I'm using it to explain a flaw. And the flaw is this. So you have a symptom, let's say pain in the back of your thigh, and you have it for a few days, and then you go to a store or something, and you buy a contraption, and you lay on it for a couple of days, and your symptom goes away. And you conclude, therefore, that because I had the pain for a few days, and then I used this treatment for a couple more, and it went away, it must have been that treatment that made it go away. And nothing could be further from the truth. That is just coincidental, meaning it happened at the same time, and it seems to have done it. It seems to have done the trick. It seems to have cured her sciatica from whatever cause. And but who knows? Maybe if she had put a lay of garlic bulbs around her neck for 2 days, the pains would have gone away also. And the other major point that this dear woman mentioned is treatment, that she had a symptom, she bought a machine, she took the treatment for the symptom. And that is not what I do. You're all encouraged to try things. I don't want to discourage you from trying different things for your aches and pains. But when you come and see a professional, a doctor, a specialist, our job, my job, is to diagnose the cause of your symptom, in this case, sciatica. In other words, is it a pinched nerve, a slipped disc in the back? Is it spinal stenosis? Is it coming from the sacroiliac joint? Is it coming from the hip joint? Is it coming from a torn hamstring? Is it actually coming from an irritated sciatic nerve, which, believe it or not, is very rare? What is the cause? And then once we know the cause, then we decide on what treatment to best use. We don't say, oh, let's see, you have pain in your thigh. Try this, try that, try acupuncture, try massage, try a heating pad, try ice. All these things may have some value, But you don't need me to suggest what you might try usually. You need me to try to define what's causing the problem in the first place and what's the best treatment to direct at that problem. And lying on the bed on a T-shaped machine and rolling your legs a little bit slowly this way and then a little bit slowly that way maybe would help a hip problem if the hip was causing sciatica, maybe. But otherwise, it sounds gimmicky to me, and I would be skeptical, and I am skeptical, frankly. But I'm born skeptical, and I'm paid to be skeptical, and I don't want to discourage people from trying to get better. And there's always the possibility, that I could be wrong. It's possible maybe this is the greatest thing in the world. 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. I'd be happy to talk to you about that. While waiting for this next call, let me make a couple of quick announcements. I've announced this before, but would like to repeat it. We have a soft opening, a soft startup to a new weight loss program that we've been doing now kind of quietly, offering it mostly to friends, family, and some of my patients who really have to lose weight. Embarrassingly, it's called the Portner Protocol. That wasn't exactly my idea. But in any case, it's a program that works. And we're kind of rolling out the marketing of it just in the next couple of months. So if you or someone you love or someone you know is overweight and suffers with that and can't seem to lose it on your own, which is very difficult to do, let alone maintain it, and want some help, check us out. You can just call the office 596-7300. You can check out our website, which has a page or soon will have a page all about the weight loss program. The website is www.portnerorthopedic.com. And we just hired a lovely young woman named Amy who interviewed me for about 45 minutes the other day about my passion for helping people with weight loss. And she's going to publish somewhere an article about this new specialty of mine, which isn't exactly new, but it's something I've taken a keen interest in of late. So if you're interested in weight loss, this program really does the trick, and we emphasize long-term maintenance, not so much quick loss. So there's that. The lines are still open. This is a bit unusual. We are recording the show video for the very first time, although I've tried it a couple times unsuccessfully in the past. And what we're going to do is we're going to open up a YouTube channel. I don't know if it's going to be called Portner, Dr. Portner, The Moving Body, but we're going to have a YouTube channel, and we're going to play back the show on video. Also, I'm told that iHeartRadio, right here, Clear Channel, the radio station, has agreed to set up a blog on their website with podcasts of the show. So you'll be able, if you do podcasts, you'll be able to download a show in case you miss it and listen to it in your own schedule, in your own time. So that's pretty cool. YouTube, websites, Facebook, all this Google business. It's incredible how things have changed. And there was a time when a doctor could just do a good job and over a period of months and years build up a reputation, and by word of mouth, patients would come to his office. And that's been the story of my career. I've enjoyed a very successful career of being quite popular amongst the patients, the regular citizens of our community, and also doctors who would refer patients to me, and also insurance companies and lawyers and all sorts of sources of referrals. But nowadays, if you have back pain and you're under the age of, 80 or 75, I don't want to insult anybody. If you have back pain, you might go to your computer, go to do a Google search and type in back pain Dr. Honolulu and see who pops up on that first page, and you'll go see him. So that's what goes on now, and I'm trying to keep up with the times. As long as I'm not retiring, I'm going to try my best to keep up with the technology and the digital world. Back in the day when I went to medical school, the digital world meant altogether something different. So, little joke. Let's see. No calls. I don't know why. 521-8383. Let's see. There's every show I try to talk about a fascinating case. We call this fascinomas. And last week was a big week for fascinomas. I had some very interesting cases that are either common conditions presenting in an uncommon way, or very obscure or uncommon conditions, which, of course, by definition, only happen once in a while. So most of these cases are common conditions, but presenting unusually. One of these cases just completely blew me away. It was a woman who came to me with pain in the front of her shin of several weeks, I don't remember, maybe a month or two duration. And it was only from below her knee to above her ankle on the front and outside part of her shin. And it came on especially with walking. She had no knee pain, no hip pain, no back pain, no buttock pain, no tingling in the foot. And she had swelling and redness and even some little skin lesions on the outside of her shin. And she had been to several other doctors to no avail. Nobody seemed to be able to help her or tell her what exactly was going on. But it seemed obvious from the first blush, no pun intended, but from the first look, that she had a leg problem and maybe a cellulitis infection under the skin or some kind of localized problem in the shin. After all, that's where she hurt, and you could see that there was something going on there. Long story. But it turned out in the end that what she actually had was simply spinal stenosis, very common. What was uncommon about it was that there was no back pain associated with it, no buttock pain or thigh pain associated with it. It was just pain in the leg. And also what was uncommon was that rash, that skin, that abnormal swollen red skin right in the area where the pain was. What's up with that? You don't see that with simple spinal stenosis. And what that was, it turned out, is she was applying these tokuhan, these plasters, these painkiller patches, skin patches, sticky skin patches that people put on in areas of pain, and it gives off heat and it's medicated. We use those for various reasons. And she put it on right where it hurt on her shin, and she reacted to it. She had an adverse reaction. Her skin was sensitive to it, and it caused that rash. So it completely threw everybody off the trail, plus the fact that she didn't have back pain. But it did hurt when she walked. That's spinal stenosis. Relieved when she sat down. That's spinal stenosis. She was in the second half of her life. She was in her, I think, early 80s, but anytime after 50-ish, it's common to have spinal stenosis. So all of those things fit. And I got an MRI of her back, and sure enough, it showed spinal stenosis. I got an EMG, a nerve test of her leg, and sure enough, that showed spinal stenosis. And we treated her back with physical therapy, which did not respond that well, unfortunately. And meanwhile, the poor woman is suffering terribly. I had her stop those patches, at least, so her skin started to clear up. And finally, I gave her an epidural injection, and that helped appreciably, and I repeated it, something I sometimes do. And that pretty much took care of it. And she was so grateful. She gave me a hug. And nowadays, it's a little tricky to be hugging your patients. Back in the day, it was common, and we would do it all the time. Now, for fear of some sort of sexual harassment lawsuit or something, we kind of shy away, but it's tough. And also, doctors, it's a big stroke for me when I get a hug from a patient, man. That's worth everything to me. So she gave me a big hug, and she was able to walk, and she wasn't on pain pills anymore. My goodness. So that was our fascinoma, and I'm very grateful to have been able to help her after so many had failed, and there was what's called a red herring, a false clue there. So there you go. Let's see, Barbara on line 1. Finally, Barbara, you're bailing me out here. You're on the air. Thanks for calling. What's up?
Hi. I wanted to ask about swollen knees. I got 2 swollen knees about 6 weeks or more. I went to the doctor, and he gave me naproxen. I've been taking it for almost 2 weeks. Will be Tuesday. But I am not any better, and I can't lift up my legs. I can walk okay, but I get pain bending my legs. And all I got was naproxen, and then my hands are swollen, and I'm not getting any better, so I was just wondering.
Besides giving you naproxen, did he give you a diagnosis? Did he tell you what the problem is?
No, all he did was touch a little bit on the knee and says, maybe it's arthritis.
Is it? Are your knees warm when you touch them? Is there inflammation?
He said it was, but...
You don't think so?
Yeah, it is, but I got, water in the knees or whatever.
Both sides. And what's this about your hands? Your hands are also swollen?
Yeah, numb, and my fingers, I can't grab things.
Only since you started the naproxen, naproxen?
I guess, yeah.
Not before?
Yes.
Yes, no, or yes, yes?
Yes, yes.
Not before, so it was just your knees to start with.
Yeah, I went
then
down
he gave
because
you
I couldn't put
naproxen.
on my pants or anything because I cannot lift up my leg.
Right, but I'm trying to make this clear. Your hands were fine before you took the naproxen.
Yes.
And then when you took it, those got swollen too and stiff.
Yeah.
Have you had any fever or chills or
No,
sweat?
I was okay.
And do you know why this started? Did you climb stairs more than usual, or squat longer than usual, or go hiking, or do anything out of the ordinary that could have stressed your knee like this?
No, except I got bad veins. I don't know.
Well, that's not related, I don't
Yeah,
think.
okay, thank you.
People think that varicose veins are painful only if they get inflamed and clotted. But otherwise, you just see them, and you don't have to do anything about it except cosmetically if you can't stand
I
it.
did a while back.
Right.
A few years.
So, and did he take a blood test or an X-ray?
No test, nothing. So I called, and I'm going to try to go back to see him again. But I was wondering, maybe I come and see you.
Yeah, I'd be happy to see you.
But I
don't know, of course, over the phone. It's difficult to advise you without examining you, and I don't want you to give up on your doctor right off the bat, but he didn't really try very hard. If he just touched you briefly and gave you a pill and didn't try to figure this out. Gout causes swollen knees sometimes, but usually just one side. This is both sides equally symmetrical?
Yeah, both sides. Why not just one knee? Yeah. I have both of them.
And why are your hands like this? And do you have... and otherwise, you're in good health?
Yeah, I'm okay. I just take blood pressure pills.
Mm-hmm. Right. So it's going to take a workup. Usually when somebody has swollen joints, of course, they'll see their PCP, their personal care physician,
yeah, we
like
have
you
to see
did.
them first before we could go to see a specialist.
Right. Why is that? What sort of insurance do you have?
I have HMSA.
Oh, but you have the HMO one.
No, I got PPO.
So then you don't have to see.
Oh, really?
Yeah. PPO is a preferred provider. So if you just see somebody on the list, I'm on that list.
Oh, you're on the list. Okay.
But what I started to say is usually when somebody has a joint problem, if their PCP is puzzled and can't handle it, they'll often send them to what's called a rheumatologist. Rheum is, I think, Greek for joint.
Oh.
And so rheumatologists specialize. They're internal medicine doctors, and they specialize in the types of conditions, diseases that affect the joints mostly.
Oh, okay.
And they would get x-rays and blood tests and maybe take the fluid out of your knee. But
that's what he said. Maybe I have to do that.
But I too do that. So
I don't want to
you're more than welcome to come see me, and I'll be happy to order the proper tests and try to take care of you, and maybe send a letter to your doctor telling them that you saw a specialist and this is what we think,
And so should I call on Monday?
Yeah, you can call on Monday, or if you call today.
And the one downtown is on Bishop Street. Where's that?
Right. Bishop?
Mm-hmm.
If you come down Beretania, you pass the there's a Honda dealership on the right. Alakea is on the left. The next street is Bishop. Bishop is the main street.
Yeah, I know
downtown.
where Bishop is.
So just Beretania to Bishop, and then right on Adams Lane, there's the third driveway, and right down into a parking lot if you're going to drive.
No, I'll catch a bus.
And there's tons of buses right nearby.
Okay.
When you call, they'll give you proper directions.
Okay.
You have a pencil nearby?
Yes, I do.
Write this down, 596.
596
7300.
Okay.
And if you call today, you'll leave a message probably. I don't think anybody's taking phone calls today, but if you call today, leave a message, they'll call you back. Or if you just call Monday first thing.
Well, should I see my doctor first and see what he tells me this time?
Either way.
Oh, okay. If I don't get any satisfaction, I'll just come see.
Okay, Barb.
Okay, thank you very much.
In the meantime, take the medicine he gave you and kind of stay off
of your
knees.
Out. I got only 2 days left.
Whoopsies.
Okay.
All right. But it didn't seem to help that much.
No,
you'll notice.
Advil was better.
You'll notice starting tomorrow when you don't have any more, or Monday, you'll notice when you stop, if that makes a difference. Because that, too, is informative, okay?
Okay. Thank you very much.
All right. Thanks for calling.
Have a good day. Bye.
You too. Bye-bye. That was Barb. And I don't like to solicit people to come here, to come see me in lieu of their doctor. Whoopsies. Thank you. I got another caller, but a little malfunction, I guess, in the computer here. I have a little screen. Perhaps you can see it here. I don't know. But and over here. That usually tells me who's online. But there is a Kelvin online, too. Let me take that call. Kelvin, go ahead. You're on the air, and thanks for calling.
Yes, thank you for taking my call.
You bet.
I have a question that's offshoot of that person that called with the bid bath and whatever. If I went to a holistic clinic that offers several things like massage and acupuncture and herbal medicine, et cetera, et cetera, et cetera.
Right.
What kind of license should I be able to see that they have? I know that acupuncture requires license.
Yes.
Massage therapist requires license.
Yes.
What about the business itself? The operator, the owners, all they have to have is a business license?
I'm not sure. Of course, they'll need a business license to charge taxes. But aside from that, I'm not sure if they need some sort of a health clinic license through the Department of Health. You can call the Hawaii State Department of Health, and or I don't know what they call it, maybe public health, and ask them. I know naturopaths who often practice this type of practice. They need to be licensed, naturopathic physicians, and like you said, of course, acupuncturists, massage therapists, chiropractors, they all require licenses. When you go to a clinic like this, you go with a certain leap of faith that whatever your symptoms are, they may respond to one or more of these available treatments. You'll walk into the clinic, you'll say, my problem is I have back pain or neck pain or whatever my problem is. What is your problem, by the way, Kelvin?
No, I don't have any problems. But
you're just curious.
Pretty healthy.
What I was trying to get at was this, that you'll go to this clinic with a symptom. A lot of people go to these clinics with a symptom, and these practitioners don't really have expertise at diagnosis. If they're an acupuncturist, you'll tell them, I have a headache, and they'll give you acupuncture, as they were trained for headaches. If you tell them I have a stomach ache, they'll give you acupuncture for stomach ache. If you go to a massage therapist, they'll give you a massage. If you go to a chiropractor, they'll adjust your spine. If you go to a Chinese herbalist, they'll find you some Chinese herbs. If you go to a Rolfer, you get Rolfing. If you go to a reflexologist, you get reflexology. It's almost like going to a restaurant, looking at a menu, glancing up and down the menu and saying, let's see, what'll I try today? Let me try some acupuncture. Seems to be on sale here today. How's your acupuncture? In medicine, we don't like to practice that way unless we absolutely have to. And we have to sometimes when we don't really know the diagnosis, but we at least strive to figure out the cause and then decide which treatment might be best. So I'm not being critical of acupuncture. It's an ancient cultural practice. It's very vibrant in China and in Asia generally, and many people use acupuncture for almost all their health needs. Unless they're having a serious, bleeding to death, bad infection, then you might go with the penicillin, you see. But it's not how I practice. I do practice holistically in the sense, and that's with a W, I might add. I do practice holistically in the sense that I don't believe that the body parts are separate from each other and from the body as a whole and from the mind as a whole and from the spirit as a whole, in matter of fact. I know that I'm dealing with human beings, and even if they only have shoulder pain, that I do try to approach them as a human being that has a shoulder problem that I have to figure out, but I also have to understand who is this person, what kind of work does he or she do for a living, what kind of sports or physical activities do they enjoy, do they have young children, do they do gardening, are they able to sleep? And I have to address these broader questions, not just take an x-ray, give a shot, treat the shoulder, and on your way. And also, I address long-term rehabilitation. How did this happen in the first place, and what can I do to help the patient prevent it going down the road? To me, that's holistic practice. But to be perfectly honest and candid, I think there's an expression you might be familiar with, caveat emptor, let the buyer beware. Sure. And there's a lot of charlatans out there. Some are willfully deceiving, and sometimes they not willfully deceiving. They sincerely believe that what they do is helpful, and indeed many times it seems to be. But be careful, and if you decide to try something like that, do so. And check out the credentials like you seem to be doing, and make sure that you don't sign up for some kind of 6-month pay in advance discount. Try whatever you want to try, even if it's me, for a week or two, and make sure that you're getting some results. If not, question it. And don't let people tell you, well, it just takes time. You got to have patience. That's not usually the case. All right, Kelvin?
Right.
So caveat emptor, okay?
Buyer beware.
Okay, thanks for the call. I appreciate it.
Bye-bye.
Bye-bye. So that was Kelvin. Great call. And lines are open still. 521-8383. Let me drop that off the screen. We're having precious few calls today. I'm not complaining because we have plenty to talk about, but it's the calls that give this show life, I think, that while I'm reluctant to actually give you, the caller, specific advice without actually seeing you, I use whatever subject your question brings up as a springboard to try to teach all the listeners. And I understand there are hundreds, if not thousands, of you guys out there. And thanks for that. I appreciate all the people that listen. And I use whoever calls in. I use that. To start a conversation or a monologue, I suppose, and teach as best I can. I think the word doctor means teacher, Meanwhile, I'm looking backwards. Why? Because my person. Should I just take line 1? Maybe I will, without knowing the name. Hello, you're on the air, and thanks for calling.
Yeah, hi, Doctor.
Hi. Yeah, something's on the fritz. We're having a technical snafu.
Okay.
And I don't know your name. What is your name? First
Harry.
name?
Harry from Kaneohe.
Kaneohe. And how's the weather in Kaneohe right now?
It's nice outside.
Is it? It's starting to clear up here, too. It's a little bit rainy. It was pouring in Manoa.
Oh, boy.
Where I live.
I could use the rain in my garden
I think
here.
you guys are about to get some serious rain, though.
Yeah.
Yeah. In the next few days. Anyway, how can I help you?
Well, number one, I'm doing fine now, but let me back up.
Thank you.
And then I'll give you what I think was the cause. Okay. Never had any problem with joints. Never, never, never. And so I'm sitting Monday afternoon in a very comfortable, soft, swivel, rocking type chair. Terrible, terrible posture as always. And so I go to get up, and I had the worst pain I've ever had in my life in the inside of the middle of my knee.
So wait, let me get this straight. You're sitting there minding your own business.
Right.
Nothing strange happened earlier that day?
Well, I'll come to that.
Oh, I see. Maybe something strange did happen. Keep it clean here, Harry. We got children listening.
Okay. Yeah. Anyway.
Yeah.
It was the worst, honest to goodness, the worst pain I've ever had in my life on the inside of the knee. I couldn't put a bit of weight on it at all.
Oh.
But yet, when I sat down and moved the knee, it was okay. There was no discoloration.
It was weight-bearing.
Weight-bearing. No swelling, nothing.
Uh-huh.
So I walked stiff-legged and finally it began to subside. And by evening, I could live with it.
I see. So it began to subside over moments or minutes or hours?
Hours.
Wow.
And then went to bed, got up, and it was bothering me a little bit. But believe it or not, the pain disappeared, and we went, of all places, to Costco.
Yeah. And it disappeared just as mysteriously as it showed up.
Yeah.
Just like that.
Yeah, slowly. Okay. Now, to go back earlier that morning, I was having breakfast at the Key Project, and a friend of mine who's slightly disabled said, I can stand on my toes, I can stand on my heels, and he showed off a little bit to me. So I showed him I could jump.
You thought you could jump.
I'm nearly 84 years old, so I jumped up in the air a number of times, showing off. And also, I went back in to help put away the tables and the chairs and so forth.
Right.
And that was preceding it all.
Uh-huh.
So I saw him the other day, and he said, well, it must have been you strained a tendon, and sometimes it takes 6 hours for you to feel it.
I don't buy that.
Okay, good.
I don't buy the tendon theory, but you did something to some structure that took about 6 hours to subside.
Yeah.
And you haven't had any problems before or since with this knee?
No. Yesterday morning we walked for an hour, the wife and I.
Yeah. And so I would only be guessing here, Harry. I don't know what this is. Sometimes people have a loose, what we call a loose body, a piece of meniscus or a piece of cartilage that maybe got chopped loose when you did that little acrobatic jump.
Which I hadn't done for many years.
Yeah, decades perhaps.
Yeah, decades.
And that may have loosened this little piece of cartilage that was in the way.
Uh-huh.
And then over time it sort of floated out of the way. If I'm right, you may notice that it might from time to time float back in the way and hurt again.
Uh-oh.
But I don't know that for a fact.
That was horrible.
It was horrible. And but the good news is it's gone. And as long as you avoid jumping, maybe it'll never come back again. So let's just watch and wait and see. Meanwhile, continue to live your life every day.
Right.
Carpe diem. I'm full of all these two-word expressions.
Well, I'm only calling because you said you needed calls.
Oh, I appreciate it. Is this the famous Harry? What's the date today, Harry?
Oh, today. What is? Oh, August 1st.
You see, now you, what
yeah,
year?
I was listening. Believe me,
It could be,
I was on guard.
Yeah, you're on guard. 2015, because they may play this show when both you and I are long gone.
That's true.
So August 1st. You see, you had to hesitate. You had to think about it. And I remember you coming down on me one time because I couldn't come up with the right date.
Yeah, I'm the guy, yeah.
You're that guy.
Oh, yeah,
I
I'm with you.
appreciate
Well, I
you
was
being
on the
out there.
computer, doing some things, answering something, and I heard you tell this lady that that she was rescuing you or something.
What was that? That I was...
Earlier, a few calls ago.
That I told her what?
That you had rescued... she had rescued you because you were getting phone calls or something.
Throwing me a line here as well. I appreciate it, Harry.
Yeah, that's it.
All right, stay healthy and keep an eye on that knee, but for now, forget about it.
Yeah, you do the same. Thanks, Lowe's. Okay, Doc.
Take
Bye.
care. Thanks
Bye.
again. This guy, he emails me sometimes, good show, or, sometimes if I can't come to the show, if I'm sick or out of town, and they play not just a recorded show, the first one, but the second show gets recorded. A play is a recorded show. And once in a while, they'll make a mistake, and they'll play the exact same show that they played at 6. They'll play it again at 7. And this dear listener writes to me, because I might not have listened, and says, hey, they played your same show. So, of course, no one's going to listen to the show twice. And then I can complain to the radio station. Anyway, thanks again for that, Harry. Let's see. Mary is online, too. Mary, go ahead. You're on the air, and thanks for calling.
Hi. I love to hear you every Saturday.
Well, thanks for saying so. I appreciate it.
And for the past 2 weeks, when I get up in the morning, my heel on one of my foot is sore. There's a pain, and I have to kind of walk on my front part of my feet. And then after a while, it goes away.
Hold on. Let me interrupt you so I get a better picture. I'm trying to imagine. When you say your heel, you mean the bottom of your heel, the back
bottom
of your
part,
heel?
and the middle part.
The middle bottom.
Yes, and I went to the doctor, and he said it's a heel pain syndrome.
Well, that's true.
And
that doesn't
I have
tell
to
you
wear
anything.
shoes all the time and get arch supports.
Well, how long has this been going on?
Oh, just about 2 or 3 weeks.
And it's not getting any better?
No, that's why I went to the doctor.
And you just went to the doctor recently?
Yes, just the other day.
Well, heel pain syndrome, I mean, that's rather descriptive. Syndrome means a collection of symptoms, and your collection of symptoms is pain in the bottom of the heel.
Yes.
And worse in the morning when you try to walk.
No, when I get up.
When you get up, even before you walk.
Yes, as soon as I get out of bed, it's
So you get up out of bed, it's sore, and you kind of hobble to the bathroom using the front
and then later
foot.
on, it gets better.
Right. That, without telling you over the phone exactly what this is, that history exactly reminds me of the history of a plantar fasciitis. Now, plantar fasciitis is a specific diagnosis. It's what I'm driving at week after week, day after day. It means that the fascia, this is a thin sheet of tough tissue under the skin of your foot that attaches to the bottom of your heel bone, and it's kind of inflamed. Itis means I-T-I-S at the end of a word means inflamed, so fasciitis means inflammation of the fascia, and it's very, very typical. I'd need to examine you to know for sure, but there is good treatment for this. Not just an arch support, no, and not just wearing shoes in the house, although maybe that will help for now. Has it? Do you wear slippers and it doesn't feel as bad?
No, I just wear barefoot. I don't.
Yeah.
And then
who wears slippers?
And outside, I just wear rubber slippers or sandals.
Yeah, but by the time you get outside and move around, it's already feeling better.
Yes,
isn't it?
yes.
And then maybe by the end of the day, if you spend a lot of time on your feet, it might be sore then as well.
Just a little. If I poke it or,
how did I know that? Because I've heard this story 1,000 times.
Oh.
And this will respond one way or another to treatment. Either physical therapy, they do what's called fascial release, and they teach you some exercises. And yes, sometimes a certain type of orthotic can help. And or if it's really bad and it doesn't respond to initial therapies, we go ahead and give a shot there. And that is without promising, that is predictably effective.
What causes this? Is it because I'm...
That's what I'm asking. Why? What? Who? Why? Why is this happening? No one knows. I don't know. It's got stressed, and it got partially pulled off of its attachment to your heel bone. I don't know why people get this. I mean, sometimes the reason is obvious. They come to me with a similar complaint after going on a trip where they did a lot of hiking, and that just caused extra stress that the foot wasn't used to, and it broke down. But more often, we just scratch our heads and say, I don't know why I got this. But anybody that wakes up with pain on the bottom of their heel,
yes,
and they hobble to the bathroom, and then after a little while, it kind of feels better.
Yes.
That's plantar fasciitis until proven otherwise, as far as I'm concerned.
Is that serious, or?
Well, no. I mean, I'm serious, and the condition is not going to cause premature death. It's not that serious. It's not cancer. It's not that serious. It's treatable, so it's not necessarily going to become a chronic condition. It's not that kind of serious, but it's serious enough for you to go to the doctor and enough for you to suffer every morning and be, at best, put out by this.
Okay.
So don't let it get worse. Don't live with it too much longer. Have it treated one way or another.
Okay. So not necessary to go run out and get those arch supports right away then?
You know, I'm loath to contradict your doctor. He saw you. I didn't. Maybe you have hyperpronation of the feet. Maybe you would benefit from that. I'm not here to tell you not to do something that your doctor said to do. But I don't like the way he called it heel pain syndrome, because that's what you came in telling him you had.
Yes.
But maybe he used that because he didn't want to use a scary term like plantar fasciitis.
Yeah. Okay.
And, but if you still are suffering 2-3 weeks from now, get another opinion.
Okay, I might come see you then.
So.
Do you look at this kind of problem?
All the time.
Okay. Thank you so much. I enjoy your show.
All right. Thank you.
Bye.
Bye-bye. Thanks for calling. Let's see. It's 7:53, so we have time for another one caller or two. I have Mike. Mike, go ahead. You're on the air, and thanks for calling.
Yeah, thanks, Doc, for taking the call.
You bet.
Hey, quick question. Last week I had a wart taken out of my left foot, and about 3 days later, I had this tremendous low back pain where I couldn't walk. I had to take some time off of work.
Have you had that before, this back business?
Very irregular. I mean, maybe once every 6 months or so.
I don't see how the two are related, unless maybe the position you were in when did he burn it off or use liquid nitrogen or electricity?
Yeah. I've been trying to keep weight off of it. They injected it, and then.
So maybe you altered your gait, the way you walk, and maybe that threw off your pelvis and lumbar spine and caused the pain. But otherwise, there's no direct connection between having a wart treated on your foot and low back pain. And you get it from time to time, so it may be purely coincidence. But when you tell me that you're having trouble walking and you're avoiding that area, that alteration in gait is the word we use to describe how somebody walks. So the alteration in your gait may be the cause of indirectly of throwing off the alignment of your spine and pelvis, and maybe that set off this condition that you get from time to time. And are you now suffering both with back pain and the pain of that procedure?
Well, I've been trying all different types of techniques to try to alleviate the pain in the back, and it was actually the injection was the only thing that really kind of eased the pain.
What injection is that? I didn't catch that.
One of the local, with that urgent care clinic, I went in and explained the situation, and I guess it was an anti-inflammatory, steroidal, or
it was a cortisone type injection.
It might have been, yeah.
And was it done
effective?
Was it done just in the room, or was it a fancy room with X-ray and so on?
Just done in the room.
So you probably got in the muscle there some cortisone, and that took care of it. In the meantime, are you still limping? Is your gait still altered by this?
Well, I can feel it's still tight in that area. Is the cortisone masking the pain
Well, it's taking away inflammation. It's not a pain medicine, but it's a strong anti-inflammatory, and inflammation is likely causing the pain, so it takes away the inflammation. But I have a feeling that your foot is still problematic. How long ago was this procedure on your foot?
It's going on about a week. I mean, it's still painful if I push in that area.
Right,
but
so you're still walking a little funny.
I might be walking a little funny, and the doc says to make sure that as it's healing after this injection that I use really good posture and not.
What you might do until your foot feels better is get a cane or a couple of crutches and walk more upright. So because if you continue to walk funny because your foot continues to hurt, you're just going to re-injure your back.
Right.
So you have to take away what the likely cause is. And that seems to be a biomechanical problem related to your altered gait. So get some crutches or a walking stick so that you don't limp when you walk. And lie down a lot this weekend or be in the water a little bit. And
and then would you recommend ice versus heat for that situation?
Yes. I mean, ice is quite good. You want to do it not more than about 20 minutes at a time, but you can do it as often as you like. And if the back pain persists, see a specialist, come see me or see your regular doctor, and so on.
One last question is now doing more core strengthening exercises.
That's excellent, but maybe hold off until your back is feeling better. But yes, core is imperative. Listen, I'm going to run out of string
thanks
here.
Thanks so much, Doc.
Yeah, thanks for the call. Feel better. All right, Mike?
Okay.
Take care.
It. Yeah.
Bye-bye. We only have another 15 seconds or so. So, Sabello, thanks a lot for your assistance, your technical assistance. And we've videotaped this show. Hi, everybody. And otherwise, go out there, have some fun, and prepare yourself for a possible hurricane, although I don't know. I think it's dying down, but be prepared. Have fun, and we'll be back next week. Bye-bye.
Thank you for listening to The Moving Body with me, your host, Dr. Bernie Portner. Hope you enjoyed the show. If you couldn't call in and have a problem with your arm, leg, neck, or back, or were too shy, you can call the office 596-7300 and get an appointment to see one of us live and in person, either at our new office downtown on Bishop Street or over on the windward side in Kaneohe. That's 596-7300. Remember the warning signs if your doctor tells you that you're getting old or it's just your age or the x-ray's normal, there's nothing wrong, or just live with it. Get another opinion. You don't have to always live with these things, and it's worth getting a look. Also, we have a new weight loss program called the Portner Protocol. If you or someone you love really needs to lose weight seriously, why don't you check it out? Call the office again, same number, 596-7300, and get a free consultation initially to see if the program is right for you. A reminder, check out our new website, www.portnerorthopedic.com. You can learn all about our clinic, our new weight loss program, our new regenerative medicine program, all the other non-surgical treatments we use, and our wonderful staff. www.portnerorthopedic.com. Finally, we do have new treatments called regenerative medicine, and it's very exciting, and you can find out more about it. The use of stem cells, PRP, or platelet-rich plasma, Prolo-Therapy, things to regenerate tissue. Very exciting. Anyway, again, thanks for listening. Get out there, have some fun, exercise, and we'll see you next week.